No one plans on coming and seeing me today. Unlike when I was a pediatrician, you plan on going to the doctor. So usually people are having a pretty bad day when they come and see me.
Got a 17-year-old male with bilateral leg and neck back pain.
He's 18, clear, 99% on an hour breather.
Ejected over 50 feet off his motorbike after head-on collision.
Normal respiratory effort, you can't breathe still. You're in there close to trauma. You got about 15, 1-5 minutes to get around here. You got it.
I do copy your assessment. I thank you very much for that. I copy that the neuro is potentially abnormal. Go ahead and make your destination Loma University 50-minute ETA at this time.
Head on with vehicle intersection, going approximately 50 miles an hour. He slid about 50 feet.
Was he wearing protective gear?
He was wearing his helmet.
Airway's intact. Breath sounds bilaterally. Do you have anything that's hurting you right now?
Can you throw us on his finger?
Everything kind of hurts. Both
Just
legs
gonna put a
hurt.
sticker on your finger, buddy.
Yeah. Where does your ribs hurt?
Right there.
Right here it hurts.
Down lower.
A little bit down lower. Did you pass out? You cold?
Nervous?
Okay. Pupils are active, 4 to 2, brisk
You want
bilaterally.
to put this on your tongue for me, buddy?
Okay. It's got abrasion on the anterior right knee, lateral right ankle. What hurts? Your left ankle. That hurts down there?
Yeah.
He's got pain on his left ankle. I don't see any deformity. Still has good pulses.
Do your parents know you're here yet?
Yeah, my dad was there when I crashed.
I don't see any fractures on the chest as of right now. I was also concerned about collapsed lung, especially where he's having all that pain on the right side. I'm going to wait until it gets sent over to our big machines where I can actually blow up the image a little bit more because I really can't tell from there. But nothing really obviously or anything like that. The rest of the heart looks okay. So as of right now, I don't have any specific injuries for you, but we're really early.
The fireman said it was 51 feet, so he was thrown 51 feet off his bike, and the forks are totally broken. The bike's totaled. I'm surprised he's alive. So it was a pretty bad accident. You okay? You feel a little bit better than you were over there. You weren't moving. So what, the guy hit you?
I was going, I was going pretty fast, and the light was yellow. I just thought I had enough time, and I didn't, I guess.
Good thing you had your helmet on, Patrick.
I can't even believe I survived that.
Well, we're glad you did. We're going to get some x-rays and some CT scans, and he's got some signs of injury, some symptoms for injury, so I don't exactly know what those injuries are, but I suspect it. So we're going to get some more films. Looks okay. I looked at your scans of your abdomen. I'm waiting for the radiologist to read them, but I don't see any type of significant injury at this point. You're pretty lucky. You're a lucky guy. Plus you got, this goes all the way up. Well, there's more good news.
Okay.
The spine films look okay also, and there are no broken bones on your arm or your leg that I can see. So I think he's having a lot of pain right now. That's probably muscular pain.
Okay.
Kind of the whiplash, my body just took a beating. I'm gonna hurt all over kind of pain.
Okay.
I mean, we gotta see if we can get him up, road test him. There might be an issue with pain control, and if we really are having an issue with pain control, then we may need to bring him in to observe him for a little bit of time.
Okay.
But we'll go from there, see how he does. All right. Were the scratches on the helmet new?
Some are new, some are old.
Do you know which ones are new?
You know what? I know this stuff is new, so that's when he hit. And I think this stuff here, this one's old.
That one's old. Okay. All right. Okay.
Yeah, thank you very much.
Thank you. I specialized in the kids who have had a number of things. One of the, far extreme would be the full traumatic arrest. So we're doing CPR, we're placing lines and tubes in order to keep a person alive. The other end of the spectrum would be a parent that's concerned about a rash, a cough, a cold, a fever.
So we have a baby who has a fever, and the really young babies, when they're less than a month, it's hard to tell if they might have meningitis. So we don't worry about that as much for an older baby, but for the really little ones where you can't get a really good exam, any baby who has a fever, we have to do a lumbar puncture, which is an invasive test to take some spinal fluid and send it for analysis and send a culture to see if it's showing signs of a bacterial infection. It involves basically putting a needle in the lower back to withdraw some fluid. And actually this patient had another attempt at another hospital and they weren't able to do it. So we're hoping that we can get it this time. Oh yeah, there's CSF though. See how that looks a little clearish? Yeah. So now we'll send this off for our analysis here, and then a culture, which is the kind of definitive test to tell us if there's a meningitis, which is an infection around the brain. Usually the culture takes about 2 days to come back. So for a baby this age, we don't take any chances. We keep them in the hospital and give them really strong antibiotics in case it is a brain infection. All done. So now we'll go get mom and dad and tell them that that went well.
The draw, I think, to this profession is just waiting and seeing what comes in and being able to take care of anything and trusting your training that you can take care of anything that walks through the door.